મારા હસબન્ડને બહુ જ દાંતનો પ્રોબ્લેમ હતો.
મારું મોઢું આટલું ખુલતું હતું.
Unable to eat, unable to chew.
A challenge for me as well to, give him that prosthesis and caps.
The treatment, he's able to eat 25 pani puris in one go.
મારું નામ સંદીપ મહેતા છે. મારું મોઢું આટલું ખુલતું હતું, જે મારી ઉંમર 18 વર્ષની હતી. ત્યાર પછી મેં કોઈ પણ પ્રકારની ટ્રીટમેન્ટ નહીં કરાવેલી, પણ દાંતના ખરાબીને હિસાબે હું ડૉક્ટર કોમલ શાહ પાસે આવેલો. એ લોકોએ 2 કલાક સુધી ટ્રાય કરી, પણ અંદર હથિયાર નહોતા જતા અને દાંત બહાર કાઢી શકાય એવું પોસિબિલિટી નહોતી. એટલે એમનું સજેસ્ટ કર્યું મને સુમિત મહાજન સર્જન સાહેબ ડૉક્ટર, એનેથી સર્જરી કરાવી, અહીંથી ક્રશ કરી અને અંદરના 9 દાંત રિમૂવ કર્યા.
With years of experience in dentistry, I would really be wrong if I say that it will be a dentist's nightmare if we are not able to see the tissues that we are treating, the teeth, the gums. So what I'm talking today is about a condition called as Oral Submucous Fibrosis, commonly known as OSMF. It is very common. The prevalence in India is increasing. The cause of it is betel nut chewing, more so. So what happens in this condition is the patient's mouth opening is restricted. So they have something called as trismus. So the opening that we get to see is maybe 1 to 2 centimeters. So one such difficult case of ours was Mr. Sandeep, who was referred to us. So when he visited us, he came at maybe stage 2, between stage 2 and 3 OSMF, where his opening was 1 to 2 centimeters. In layman terms, you can just put one finger of yours in the mouth. Not to mention the difficulties that he faced, unable to eat, unable to chew. There is fibrosis of the cheeks tissues. They are very hard. The tongue, they can't eat spicy food. There are lesions on the cheeks and a multitude of issues.
So when I saw Sandeep Mehta for the first time, I know it was a very, very difficult case. And when I saw the X-ray, Komal came to me that, he wants to get his teeth sorted. I was like, this is going to be damn tough. Multiple teeth needed extractions. And with the oral opening of just one finger, we could barely put our mirror in the mouth. And I said, okay, let's try. And I called my friend who is also an oral surgeon. I called him for a consult. I showed him the case. He said, Neil, this is not possible. We'll have to take you in OT. So I told him, Sujit, forget it. Yeah. Why do you want to do it in OT? Let's try it clinically. And we made an attempt and we failed miserably. We just couldn't put our hands in the mouth. And we tried extracting a couple teeth, but nothing worked. Thankfully, Mr. Mehta himself was very, very cooperative, very, very motivated to get his dental treatment done. And he readily agreed, to get admitted and go in the OT and get all the treatment sorted. And we devised a plan where we were going to not only remove all his teeth, which were bad, but we were also going to improve his oral opening so that in future, whenever he needs any dental treatment, we can easily sort it out. And then one fine day, just took him in the OT, and along with extraction of all his teeth, we released all the fibrous bands which are there in the oral submucous fibrosis. And after releasing the bands, we took a fold of skin from here along the nose and put it in the cheek. And we could improve his oral opening by almost 3 fingers, which really, really helped him. And he was so happy, after that he did not feel the need for a dental treatment. And he just disappeared. And he was absolutely, good with whatever teeth left in his mouth. So that was the positive part. But not doing the dental treatment, we were not so happy about it, because still, there were missing teeth which need to be replaced so that he could improve his chewing. So thankfully, a year and a half later, he came back and we could treat and sort out all his dental problems and make him now functionally very active. Yeah, so that gives us immense joy, when you treat cases like this. Once in a while, you get to treat cases like this. And as a practitioner, as a clinician, having for so many years. These are the challenging cases you really want to treat and, bring impact on patient's life.
એ પછી એમણે મને અંદરના એક દાંત અને એક દાંત બીજા બે ખરાબ હતા એ રિમૂવ કર્યા. એ પછી એમને મને કીધું કે તમારે 24 દાંત બેસાડવા પડશે, તો એના માટે થઈને ટ્રીટમેન્ટ કરવી પડશે. તો પહેલાં મારું રૂટ કેનાલ કર્યું. ડૉક્ટર સાક્ષી એ મારું રૂટ કેનાલ કર્યું. એ પછી એમને પ્લાસ્ટિકના દાંતથી મારું માપ લીધું અને માપ લઈને પ્લાસ્ટિકના દાંત બેસાડ્યા, જે મને 10 દિવસ સુધી અંદર રાખ્યા હતા. એ પછી મને કોઈ તકલીફ નહોતી અને જે ટ્રીટમેન્ટ કરી એ દરમિયાન હું ઘરે ગયો, મને કોઈ પ્રકારનું દર્દ નહોતું અને હું ખાઈ શકતો હતો.
So with Sandeep Mehta uncle, he had basically a constricted mouth opening, and that's where I come in because I have tiny hands. I was able to reach with my instruments and everything. So I was able to restore and do root canals for him, give him crowns and everything. Since his mouth was constricted and he couldn't open it completely, it also creates a lot of pressure, when we are doing the treatment. So if I'm taking time to do the treatment, the patient also is in discomfort. But somehow he was so great, he was so cooperative that, I just had to split the whole thing in two sessions, and we were good to go after that. He was very cooperative and would, just be like, Shiksha, you keep doing and keep motivating me, and, I'm not in pain. So I could do the treatment at ease, and that's what I loved about this case. And it was a great challenge for me as well to, give him that prosthesis and caps.
મારા હસબન્ડને બહુ જ દાંતનો પ્રોબ્લેમ હતો અને મોઢું પણ ખુલતું નહોતું. કહેવા મુજબ અમે એમને ટ્રીટમેન્ટ કરાવી અને બધા દાંત કઢાવી અમે નવા નખાવ્યા. એ નવા દાંત નખાવ્યા પછી અમને એટલો સંતોષ છે ને કે જે વસ્તુ એ ખાઈ નહોતા શકતા એ હવે એ પ્રોપર એ ખાઈ શકે છે અને કંઈ જ એમને તકલીફ નથી. ધારો કે એમ કે પાણીપુરી છે, ફ્રેન્કી છે, દાબેલી છે, એ કંઈ પણ નહોતા ખાઈ શકતા અને એમને જરાય પણ દર્દય નથી થયું અને એમને એકદમ શાંતિથી બધા દાંત રિમૂવ થઈ નવા દાંતે બેસાડ્યા અને અત્યારે એમના ફેસનો હાવભાવ, એમના ફોટા પણ સરસ આવવા માંડ્યા, એમના ચહેરાના આખું અલગ જ આમ ફેસ થઈ ગયો. ડૉક્ટર નીલ, ડૉક્ટર શિક્ષા और ડૉક્ટર કોમલબેનના ત્રણેય અને એમના સ્ટાફ તરફથી અમને પૂરેપૂરો સહયોગ મળ્યો છે અને અમને પૂરેપૂરું સંતોષ થાય એટલું કામય સરસ હતું અને અમને ખૂબ જ આનંદ છે એમના ત્રણેય તરફથી.
While the treatment was going on, the wife was talking about the food items he was not able to eat, like pani puri, dabeli, frankie. And now, after the treatment, he's able to eat 25 pani puris in one go, which is definitely one of a success story.
Very happy to see him eat whatever he wants to now. The idea here is difficult cases with technology, with the right knowledge, with the right kind of treatment can be treated. And the patient should not have to suffer, because once the patient suffers, even the family suffers.